Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 5 new cases of COVID-19. The total number of cases is now 262. The total number of COVID-related deaths in Manitoba remains at 6. As of this morning, 7 individuals are hospitalized. Of that, 2 are in intensive care. As of this morning, 174 individuals are listed as recovered. There are 82 active cases. There was an error in our reporting numbers yesterday in regards to total number of tests completed. We reported 21,601. The actual total was 21,061. And so as of yesterday, an additional 327 lab tests were performed. That brings the revised total date to date up to 21,387 tests. As we announced last week, we have expanded our testing criteria to include all symptomatic workers or volunteers who are still working outside of the home. This includes people in construction and transportation and manufacturing, in grocery stores, at daycares, or other critical businesses. So if you're working in an industry that was not shut down by the public health orders and symptomatic, you are eligible for testing. Any symptomatic person who lives with a healthcare worker, first responder, or a worker in congregate settings such as correctional facility, shelter, long-term care, or residential facility are also eligible for testing if you are symptomatic. So I want to encourage any Manitoban with respiratory symptoms, even if they are mild, who meet our criteria to get tested. You can call Health Links for further information. Our testing criteria has, for quite some time, also included those who've traveled outside of Manitoba for the past 14 days, those who have been in close contact with a case, a healthcare provider, first responders such as police, fire, or firefighters, lab workers who have worked with COVID samples, and individuals who live or work in the north or a remote isolated community or in group settings such as people living in a correctional facility, shelter, long-term care, or residential facility, or in a remote work camp. Our testing capacity has increased, and many more people are now eligible to be tested, and we're receiving far fewer samples than we have the capacity to run. So encourage symptomatic Manitobans who meet our criteria to be tested. We continue to remind Manitobans that there should be no non-essential personal travel. We know that our numbers have been relatively low as of late, but we still risk the importation of this virus. So those traveling from international destinations are required to self-isolate for 14 days under the Quarantine Act. The Public Health Act also requires those traveling from other provinces to self-isolate for 14 days as well. Every Manitoban, regardless of where they live in Manitoba, needs to practice physical distancing at this point. Stay home as much as you can, leave only for essential reasons, washing your hands frequently, certainly staying home if you're ill. And this includes Muslim Manitobans who will be starting to celebrate Ramadan this evening. So ask this year that you choose to celebrate differently. Do so virtually. Staying home with your immediate family members because it's the best way to protect yourself, the people around you, and our community at large. Connecting virtually is a good option, and we know these are trying times, and it requires Manitobans to change our normal day-to-day approaches and some of our traditions, but this virus is still circulating in Manitoba. We need to continue our efforts to keep our curve flat. Staying home for the most part also includes not traveling to the cottage or second residence. Traveling to these places only if it is required. If you must travel, then only travel with your immediate family members. Do not visit others on arrival. Avoid stopping for gas or other supplies on the way, and only visit local healthcare providers if absolutely necessary. This virus is in all regions in Manitoba. It's not only an urban issue, so all Manitobans, regardless of where you live in the province, need to practice social distancing. Stay home for the most part, leaving only for necessary reasons. When you do leave your home, practicing physical distancing at all times. I want to thank Manitobans for their efforts so far. We can see our efforts paying off in our low numbers, but we can still see we continue to detect this virus in our province. And if we let up our measures too soon, we can see propagation of that virus. And so we want to ensure that we're doing whatever we can to interrupt the transmission of this virus in Manitoba. To date, we have not seen significant community-based transmission or outbreaks in personal care homes. We've been able to increase our testing capacity and expand our testing criteria. We've continually worked to increase the capacity of our healthcare system. We are working to ensure we're protecting those in personal care homes. We have many protective measures in place already, and we are looking to moving to limit the amount of workplaces that those working at PCHs can attend. But right now, we still need to practice our physical distancing. Stay home for the most part, physical distancing at all times. But in the coming weeks, we are looking at ways to start lifting some of these restrictions. We'll look at ways to safely reopen certain non-essential businesses while others may remain closed. We need to do this in a guarded fashion and follow our numbers very closely as we begin to reopen things. And any of these changes will be introduced slowly, and it will not be a return to normal. We will still need to have restrictions in place to ensure physical distancing strategies can be managed in the places that we open. But we are moving forward. We are going to see loosening of these restrictions, but we're going to do it very cautiously. I'm encouraging all Manitobans to continue to access credible information using the COVID-19 website, manitoba.ca/COVID-19. And again, a thank you to all Manitobans for your efforts, and we're going to be relying again to continue our physical distancing strategies to keep our numbers low in Manitoba, and soon we can look to loosening some of these restrictions in a very cautious way. So thank you, and I'll pass it to Lanette.
Thank you. Good afternoon, everyone. For the past 6 weeks, we have been talking about how we are all in it together. And we've had to rely upon each other to do our respective parts to slow the spread of COVID-19 by using social distancing strategies, regularly washing our hands, and staying home when we're sick. But this message of us being in this together has extended to other parts of our lives, with Manitobans working to lift the spirits of others and help where they can. Yesterday, a Harvest Hero Radiothon was held to raise funds for Winnipeg Harvest. Like many food banks, donations have dropped significantly at Harvest in the past 6 weeks, while the needs have increased dramatically. Manitobans stepped up, as usual, in a big way, donating nearly $333,000 towards Winnipeg Harvest in one day, including 2 anonymous donors who contributed a combined $150,000. I want to congratulate 103.1 Virgin Radio, TSN 1290, and 99.9 Bob FM for hosting this incredible fundraiser. And I want to thank all Manitobans who donated to this worthy cause. Thank you for supporting our community. Your efforts help a lot of families at this challenging time. I today will give you an update on weekly statistics. HealthLinks in the past week has received about 8,000 calls. The daily average wait time varied from a low of 2 minutes yesterday to a high of 6 minutes on Sunday. Our online assessment tool has seen nearly 440,000 web views since its launch more than a month ago, including 17,000 views in the past 7 days. DynaCare has made 2,900 calls this past week to people who have tested COVID negative. And since taking on this task in late March, DynaCare has made nearly 16,000 calls to Manitobans. As a reminder, public health officials immediately contact people if they are COVID positive. And the last thing I'll just speak to is PPE. Manitoba's fight against COVID, we received a shipment of 150,000 disposable isolation gowns this week. The order came by a chartered plane and was a joint effort by the province and Spirit RX Services, a Manitoba-based medical supply company. This is a substantial shipment, and we are very happy to have it on the ground here in Manitoba. We will continue to explore all options to secure personal protective equipment for our frontline staff. And with that, we can open up to questions.
Thank you. A reminder to our reporters online, you will have one primary question and one follow-up question for now. From the Winnipeg Free Press, Carol.
Good afternoon. It's Carol Sanders of the Free Press. The Premier has said that he wants to get to 2,000 tests a day as part of the plan to safely reopen Manitoba for business. Is the current contact tracing structure able to accommodate that? Are there enough people doing contact tracing to support that?
Yeah, we would have the ability to isolate cases as well as do very quick contact tracing with the capacity we have, and we have the ability to increase that if necessary. So certainly we should be looking to have the capacity to test that many people. Certainly it's going to rely on the demand, but certainly we would be in a position to do the contact tracing and follow up on cases at this point.
Okay, so how many province-wide, how many people are doing contact tracing right now?
That's tough to know. So the initial visit is usually from a public health nurse with the case and their family, and to determine all the contacts. But then we have a public health call center which is doing the follow-up with cases and contacts. And so there's a number of people that are working there, and plus a number of public health nurses in each of the health regions working on this. So I don't have a number for that.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, Saskatchewan released their reopening plan this morning. Can you talk a little bit about how their plan could shape our reopening plan here in Manitoba? And given that we have similar numbers as Saskatchewan, would our plan look similar in terms of the dates of phases and the steps being taken to reopen certain businesses?
So I just had a brief opportunity to review their plan. It seems to take the shape of many of the plans that we've been working at our Special Advisory Committee. Seems to be following pace and direction with that. So certainly we're going to review that more in detail, but that looks along the lines of the kind of plans we have been looking at.
Thank you. And just as a follow-up, some of the first types of services they're looking at reopening are some medical services like dentistry and physio, and all of those do involve close, prolonged contact. Can you talk a little bit about how that could be done safely if those are the first businesses that would reopen?
Yeah, so a lot of that is related to the multi phases of the response. So certainly those that are at high risk, those returning from travel, will not be able to attend that. They'll need to be self-isolating. Those who are ill should be screened and stay and managed at home. And so there's a screening criteria that all these places should adhere to. There's hand hygiene, which is important. And then in certain circumstances, then we could also look at personal protective equipment as well. And so there's multiple steps that can take place to ensure these kind of services can be taken care of safely.
From the Brandon Sun, Ryan.
Hi, Ryan Seltzer with the Brandon Sun. In regards to the PPE being shipped out, I mean, how quickly is that going to be getting out to Manitobans?
It should be, it'll go to our warehouse. They'll look at who's ordered. There already are gowns that are in distribution being shipped. This will add to our contingency.
And I guess as a follow-up, I mean, how much can rural Western Manitobans expect as far as numbers go?
Well, that would depend on what their orders are, but my understanding is they are being shipped based on the PPE guidelines and the amount of service that's occurring in the regions. So the regions would be responsible to place their orders, and then it would be up to us to distribute that. And we'll be distributing smaller amounts the right amounts, but over a shorter amount of time. So we have some centralized, a better understanding of what we have and what's going out. So it won't be, we won't be sending out for like 6 weeks of PPE, but we'll be sending out about 2 weeks at a time, and then be replenishing on a more frequent basis. And that's everywhere in the province, not just rural or northern.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Question for Dr. Roussin. We're hearing from health officials in California that they went back and discovered deaths due to COVID-19 before the outbreak really kicked in the U.S. I know this past flu season here in Manitoba saw quite a few cases of respiratory illness. Is that sort of a concern that maybe COVID-19 was present in the province before it was detected? And is Manitoba able to go back and see if kind of that larger number of respiratory illness cases in flu season may have been COVID-19?
We don't really have any plans to actively look at that. You know, I think that the cluster in Wuhan at the end of last year really drew attention to this, and that's where testing began. So we're focused on our numbers now. You know, at some point we hope to be able to do some seroprevalence studies, and that will give us an idea of just the prevalence of infection in the province. It won't tell us necessarily when those people were infected, but that would be much more important for us to know is the actual prevalence of the infection overall.
And as a follow-up, you mentioned that we have 2 patients in intensive care today. That's fewer than we've seen in days past. And I know previously you'd said, I think all but one at one point were on ventilators if they were in intensive care. So part of this is kind of a good news story. Can either of you share the details of the treatment of patients and the success that we're having in kind of downgrading those patients who are in intensive care?
So you know, the numbers that I have in front of me are that three total ICU patients have been listed as recovered. The 2 that are currently in ICU are, as of this morning, are ventilated. And so that's the numbers I had. The average length of stay is a roughly 11 days for ICU clients.
From the Winnipeg Sun, Scott.
Hi, Scott Billick here from Winnipeg Sun. Just looking, there's going to be a lot of comparisons drawn to the Saskatchewan thing today, but in terms of like recreation and stuff, and golf courses obviously being a big thing for a lot of people, and other things like campgrounds and partying, will those be involved you say at all, will those be involved in perhaps the first phase of reopening?
So we're going to be looking at, a similar announcement in the next, coming week or to week and a half, and so we'll be discussing details like that when we announce our plan. So we're still looking at things. We're still looking at other jurisdictions to see how they're moving, and so we're considering all of these non-essential businesses and how our plan's going to look. So I don't have details at this point. That's going to come in the next week to week and a half or so.
And then the 5 cases that were announced today, do we have any information on those yet? Are the healthcare workers? Has this kind of been seen over the last week, or do we know yet?
Yeah, I don't have info on the healthcare worker side. I know that they're all Winnipeg residents. 2 were in their 20s, 2 in their 30s, and 1 in the 80s.
From CBC Radio Canada, Ezra.
Hi, I'm Robert Cuisino. Concerning from Radio Canada, concerning that shipment we received of gowns, could you please detail the process you use to decide how many and where those different equipments are going in the province, please?
Well, it's really dependent on what the regions tell us is their need. So when they identify that they need so many gowns, so many masks for whatever services in the province or in their region, then they will let us know, and then we will proceed to deliver that to them as quickly as possible. It would then be up to them to distribute to the individual sites and facilities so that the staff get it.
And tell me, do we have right now a concrete idea of the actual stocks of PPI we have, and do we know we have up to when? And do we know that if other equipment are coming just like the shipment we received today?
So in terms of what we know about our inventory, it has been a work in progress, and I would say we're definitely making some good strides. So in terms of making sure that we have a good understanding of how much inventory we have on hand, how much we're delivering out, and how much is coming in. We are working to actually have a dashboard in the near future so that we can share that information a bit more broadly with our staff. And then in terms of your question about equipment, are you asking if we have more equipment coming in?
Well, if you know that some companies are already in production and that the shipment of masks or gowns or whatever could arrive soon.
Yeah, we have lots of orders out there, and we hope they're coming soon. We are just appreciating the global challenge of getting our orders in and getting them in the volume that we ordered them. So the work never stops, Ezra. We continue to aggressively work with the vendors and order our supplies and await shipment.
From CBC Manitoba, Aaron.
Good afternoon. Dr. Roussin, we see today 5 new cases, which makes today the highest number of cases we've had reported in the day since 12 were reported on April 11th, which was nearly 2 weeks ago. Is there any significance to this sort of an increase today?
So we can't make much out of single days like this, so we want to continue to follow the trend. When we see a number of cases, it's not only the case count that we look at. We're going to be interested to see if these are cases that are connected already to known contacts. There may be, household contacts in here, which makes the significance to community-based transmission much less. So, we want to look at the trends over time, and then the nature of acquisition as well.
Okay, thank you for that. And I know we had the question about Saskatchewan and Saskatchewan's plan rolling out throughout May. When will Manitoba start loosening its restrictions as well? I know you said that we're modeling our plans similar to Saskatchewan.
Yeah, so we don't have specific dates on that, but we too would, if our numbers remain like this, we're looking towards May as well to be able to start loosening some of the restrictions. The details on exactly what that looks like, we're still working it out. We're still following these numbers daily, but that's the type of time frame we're looking at now.
From the Canadian Press, Steve.
Dr. Roussin, Steve Lambert from the Canadian Press. Or maybe this is best directed to Ms. Siragusa. There's a report out of Ottawa earlier today that 1 million face masks from China that the federal government had requisitioned failed to meet proper standards for healthcare. I'm just wondering whether Manitoba has been informed of that. How might that impact supplies here in Manitoba?
We weren't informed of that, but we are very aware that some of the warehouses that are providing supplies are not up to the quality that we would want and expect. We are evaluating the shipment upon, I can't speak to that specific one, Steve, but in the past and going forward, when a shipment comes, we usually work with reliable vendors that we know, and but if something comes in, anything that comes in, we will always evaluate it. We have infection prevention and control and staff health who weigh in and make sure it's the quality we expect and need for our staff. So in terms of that specific shipment, I can't say that that was destined for us, actually. I think we're in pretty good shape right now.
Okay, thanks. And my follow-up for Dr. Roussin, the Manitoba government cabinet has now passed regulations clearing the way for conservation officers and others to enforce public health orders. And I know we already have some deployed at highway interprovincial crossings and the like. But with these extra resources, where do you see them being used?
Well, I don't necessarily have details on that. I think it's we're going to respond as things develop. I think that as we loosen some of our restrictions, then enforcement actually becomes a bit more important. We want to make sure that as we loosen the restrictions, everyone is still maintaining the the limitations that are imposed. If we look to lift the restrictions on certain non-essential businesses, they will still be restricted in some manner that will still allow for social distancing. And so I think the enforcement, the oversight is going to be important as we move towards that.
From CTV Winnipeg, Michelle.
Before restrictions can be lifted, does testing need to increase, and how are we going to get testing up before May?
So it's important to have the testing capacity, which we have been working on, and we're still going to develop more. But our testing capacity is at a good place. It's just the demand for testing that's low right now. So we've recently expanded our criteria. We may well expand it further going forward. So right now it's just it's an issue of demand for testing. Our capacity for testing is where it needs to be, and so that's that's been our focus.
Okay, and so just a follow-up to that, I guess when would we look at that? How many more days, or how is there any timeline on it?
Timeline for when we're going to consider reopening?
Expanding the testing criteria.
Oh, yeah. I mean, I think that if our numbers continue to look where they are now, then I would say as early as next week we'll be looking to expand the criteria again.
From CHTM, Navi.
Good afternoon, Navi Ball with CHTM. My question is for Dr. Roussin. During last Thursday's briefing, when the travel restrictions were announced. The details surrounding how those would be enforced in northern Manitoba specifically were still kind of being worked out. So now that a week has passed, does the province have more of a concrete plan as to how enforcement on the northern travel restrictions will work?
Yeah, I think we're still looking at looking at the details of that. There's a number of options that are available. I think just like the public health advice that we've been giving at the beginning, and the reflection on our numbers is Manitobans follow advice. They follow the law, and so when we make these orders. In public health, the specifics of enforcement are less important because we know the majority of people follow our advice, and that's what we've seen laid out in a lot of our numbers here. So we're still looking at options for that, and we have a lot of options available to do that, but I don't have any specifics on that to update you on.
And in regards to potentially reopening businesses and those sort of plans, would those sort of businesses being reconsidered opening only in certain parts of the province, considering the vulnerability of certain regions in the province? So
we sure haven't eliminated any options, and so it's certainly a possibility of that. So we don't have any specifics to announce at this point. What we do know is that we're going to do this very cautiously. We're going to do it very slowly, and it's going to be according to what the numbers tell us going forward.
Thank you. We have some time left today, so we'll open it up to questions. If reporters have further questions, please proceed.
Diana from 680 CJOB. Dr. Roussin, can you kind of explain the thought process on reopening, kind of as you mentioned, schools certainly not looking like they're going to reopen this school year, but if parents working at non-essential businesses are expected to go back to work, that kind of presents some problems. Can you explain the rationale behind sort of what we're hearing might be in the reopening plans?
Yeah, and those are all things that need to be considered as we look at our plans. We're going to do it very slowly. We're going to look to reopen certain non-essential businesses. Businesses that right now that are people are able to work from home. We're likely going to still continue to encourage that. We're going to encourage a lot of physical distancing. Things like childcare, all those things are going to be considered in the plan, and so it's not finalized yet. It's not going to be set in stone, and even as we get our plan, that plan is going to be subject to change based on our numbers.
Hi, it's Carol at the Free Press. Dr. Roussin, who's the next category to be tested? Like after you get the people who are asymptomatic, or everybody who's got respiratory symptoms, who's next?
Yeah, we're not going to be expanding really to any time to asymptomatic individuals. Testing's not valuable in asymptomatic individuals, so that's not likely a place that we'll be expanding to. What's left is really any symptomatic Manitoban. Right now our testing criteria are quite expansive. So anyone could be referred for testing or tested by any clinician who felt that their client should be tested. It's open to pretty much to anyone who's still working. And so it's pretty vast right now, so it's really a demand issue. But the next step could include the families of anyone in the critical services, and at some point that also could include just any symptomatic Manitoban.
All right, that concludes today's media briefing. Thank you.
Thank you.
Thank you.